A very good evening to all of you. Today we will be doing the MCQs on oncology. Oncology is an important part of the PG entrance exam. About 40 to 50 questions are expected from the different oncology part. Some questions in pathology, some questions in medicine, some questions in surgery, breast oncology, GI oncology, reproductive oncology. So different oncologies questions will come definitely. So let's begin with the first question. Tumor exclusively seen in parotid gland is A. Mucoepidermoid, B. Adenoid cystic, C. Warthin, D. Pleomorphic adenoma. C. What about Warthin tumor? Warthin tumor occurs exclusively in the parotid gland. It is most common in males. It is most common in smokers. It is most common in the lower pole of parotid at the angle of mandible. 10% of cases are bilateral. So the correct answer here is C. Warthin tumor. Fish classification is used for. Now look at the image carefully. This is fish classification. C1 means limited involvement of vertical portion of carotid canal. C2 involvement of vertical portion of carotid canal. C3 involvement of horizontal portion of carotid canal. Now let us look at the options. A. Paravertebral tumor. B. Synovial sarcoma. D. C. Glomus tumor. D. Pituitary tumor. Well, it is for the glomus tumor. Which staging in ENT is used for glomus tumor? So correct answer here is C. Glomus tumor. Best prognosis of all thyroid cancer. Very commonly asked question. A. Papillary. B. Follicular. C. Medullary. D. Anaplastic. Well, the correct answer here is A. Papillary cancer. Best prognosis is papillary cancer and worst prognosis is anaplastic cancer. In cases of cancer breast with HER2/neu amplification, when will you do FISH? A. HER2/neu 1 plus positive. B. HER2/neu 2 plus positive. C. Irrespective of HER2/neu. D. HER2/neu 3 plus positive. So HER2/neu status of cancer breast is routinely done by immunohistochemical study with values from 0 to +1 to +2 +3. Recently, FISH, that is fluorescent in situ hybridization, is used to detect HER2/neu amplification and advised for IHC HER2 positive cases of value +2. 20% of incidence is detected and treated by trastuzumab. So the correct answer here is HER2/neu 2 plus, that is B. Most important prognostic factor of cancer esophagus is A. Length of growth, B. Depth of involvement, C. Histology grading, D. Immunohistochemistry. Now, the prognostic factors of cancer esophagus are number 1, depth of invasion, number 2, lymph node status, number 3, presence of distant metastasis, number 4, resection of margin, number 5, serosal or peritoneal involvement, D, and number 6, vascular invasion. So the correct answer here is B, depth of involvement. Which of the following is not true about GIST? GIST means gastrointestinal stromal tumor. B. Rarely occur in stomach and duodenum. B. Universally associated with c-KIT oncogene mutation. D. Size and mitotic index are best predictors of metastasis. And D. Sensitive to imatinib. Now let us look into the important points related to gastrointestinal stromal tumor. The most common in 50%, these are mesenchymal origin, equal incidence in males and females, males equal to females, universally associated c-KIT oncogene mutation, imatinib tyrosine kinase antagonist has 80% response rate on treatment, mutation in exon 11 of c-KIT are particularly sensitive to drug. Size and mitotic index are best indicators of metastasis. Clinically, GIST are very rare of all the GIT tumors. So the correct answer here is rarely occur in stomach and duodenum. Increased level of 5-HIA is seen in which disease? A. Carcinoid tumor, B. Phenylketonuria, C. Pheochromocytoma, D. Gastrinoma. It is seen in carcinoid tumor. Okuda staging is used for A. HCC, B. Pancreatic cancer, C. Hepatoblastoma, D. Renal cell carcinoma. It is hepatocellular carcinoma. Identify the triangle shown in the image. A. Callots triangle, B. Hepatocystic triangle, C. Gastronoma triangle, D. Dooms triangle. Now this gastronoma triangle, also called as Passaro triangle, About 70 to 90% will be located in the triangle. So it is the triangle boundaries are junction of CBD and cystic duct, junction of neck and body of pancreas, junction of second and third part of duodenum. As you can see, there is a junction of CBD and cystic duct. There is a junction of neck and body of pancreas. There is a junction of second and third part of duodenum. So this is a gastrinoma triangle. Most common presentation of bile duct cancer is A. Pruritus, B. Jaundice, C. Gallbladder enlargement, D. Weight loss. Most common presentation of patient is with jaundice or elevated LFT. Gallbladder is palpable in distal growth due to obstruction, that is Courvoisier's sign. Minority cases present with itching. So the correct answer here is B. Jaundice. Most common site of cancer penis is A. Glans penis, B. Prepuce, C. Shaft, D. Coronal sulcus. Most common site of cancer penis, that is squamous cell carcinoma, glands 50%, prepuce 20%, both glands and prepuce, coronal sulcus, shaft is glans penis. Recent FDA approved drug as first line treatment along with platinum based chemotherapy in stage 4 NCLC is A. Erlotinib, B. Jeftinib, C. Sorafenib, D. Crizotinib. It is Jeftinib. Administration of approved Jeftinib for first line treatment of patient with metastatic non-small cell carcinoma is most type of common type of EFGR mutation. So Jeftinib is a EFGR inhibitor. It is B. Chang staging is used for medulloblastoma. We know. Let us see the Chang staging. M0, no evidence of metastasis. M1, tumor cells found in cerebrospinal fluid. M2, intracranial tumor beyond the primary site. M3, gross nodular seeding in spinal subarachnoid space. M4, metastasis outside the cerebrospinal axis. So the correct answer here is B, medulloblastoma. Craniopharyngioma is a brain tumor arising from near Radke's pouch, B. Neurohypophysis, C. Posterior pituitary, D. Median eminence. It is median eminence. Craniopharyngioma is a brain tumor arising from Radke's pouch. These are benign cystic lesions that occur most frequently in children. Most common pituitary adenomas are growth hormone secreting adenomas, B. ACTH secreting adenomas, C. TSH secreting adenomas, D. prolactinomas. Are prolactinomas 20% are non-functioning, 15% secrete growth hormone, 10% secrete ACTH. Is prolactinomas. Most common intracranial brain tumor in adult is A. Astrocytoma, B. Metastasis, C. Meningioma, D. Oligodendroglioma. It is metastasis. Kaposi sarcoma is caused by A. HIV-1, B. HPV-16, C. HTLV type 1, D. Human semen virus 40. So the correct answer here is HIV-1. Soft tissue tumor of extremity most commonly metastasized to A. Lung, B. Liver, C. Bone, D. Lymph node. Most common site of distant metastasis is lungs, followed by bone, liver, and brain. When you do metastatic workup, you do the CT chest. Lung metastasis is in extremities sarcoma, CT abdomen and pelvis, liver metastasis in retroperitoneal sarcoma, and also intra-abdominal pelvic metastasis. So the correct answer here is A. Lung. Most microsurgery is done for A. Cutaneous melanoma, B. Dermatofibrosarcoma, C. BCCS squamous cell carcinoma of skin, D. BCC of face. It is BCC of face. Basal cell carcinoma of face. Most common type of soft tissue sarcoma in children is A. Embryonal rhabdomyosarcoma, B. Alveolar sarcoma, C. Liposarcoma, D. Leiomyosarcoma. Most common soft tissue sarcoma in children, it is embryonal rhabdomyosarcoma. Please click the link in the description to join the 2-day Neet PG Ultimate Breakthrough Blueprint. It will be highly beneficial for you because it covers all the 19 subjects in a holistic manner. So, the tumor with high frequency of spontaneous regression in children is A. Medulloblastoma, B. Renal cell cancer, C. Lung cancer, D. Retinoblastoma. It is medulloblastoma. Pheochromocytoma of extraordinary are most commonly located in A. Posterior mediastinum, B. Superior mediastinum, D. C. Anterior mediastinum, D. Middle mediastinum. It is posterior mediastinum. Idea of adrenal biopsy should be made after ruling out A. Adrenocortical carcinoma, B. Metastasis, C. Pheochromocytoma, D. Cushing syndrome. It is pheochromocytoma. Most common malignancy of vagina in infant and children is A. Embryonal rhabdomyosarcoma, B. Chondrosarcoma, C. Melanoma, D. Leiomyosarcoma. Embryonal rhabdomyosarcoma. Frey's syndrome is due to injury of which of the following nerve branch? A. Trigeminal nerve, B. Vagus nerve, C. Facial nerve, D. Glossopharyngeal. It is trigeminal nerve.